A few years ago, I was doing a lecture out in the Washington, D.C. area. So I go into a room, we were in a restaurant, about 40 prospective people looking into CEREC. And I get in the front of the room and I'm introducing myself and giving my background as a speaker and whatever I do in general dentistry. And this gentleman stands up in the back of the room and yells, "I don't even know what the hell I'm doing here."
November of 2011, got an email from Sirona that they were giving a dinner at Maggiano's, a restaurant in Tyson's Corner, Virginia. So I responded that I would be there.
And so he said, "Wow, my rep told me I should come out here and learn about this CEREC thing, that it'd be a good fit for my practice."
I knew what CEREC had become. I knew about the materials, the new way that we luted materials.
I said, "So, what's your concern?" He's like, "I'm 70 years old, and why should somebody my age be getting into something like this at 70 years old?"
You know, I'm a little older than most of the dentists. Most of my friends have already retired.
Well, let me tell you then a story about a person I know that does CEREC. His name's, we call him Dr. Chuck.
At the time I got into CEREC, you know, I had been getting visits from my CEREC specialist, who was a very knowledgeable CEREC specialist because he came from the lab side. He was a lab technician. And I was having entirely too many failed porcelain fused to metal restorations. And that's what softened me up. I have since learned that a lot of that problem was me.
One thing that's amazing about the CEREC world, you know, this kind of little microcosm we're in, is the community. It's like nothing else in dentistry. You feel not only the need, but the want to share your information, your knowledge, your help with people who are coming in. Because you remember what it was like to be that person sitting in a room deciding, is this for me or is it not for me?
When I started looking at CEREC, I also looked at all the other systems. I'm the type of person who would like to have good support, and I saw immediately what Sirona offered. There was always support, CEREC doctors for a new dentist starting in this technology. It was great to know that I could get immediate response. And it was reassuring to see that other new members and new users were willing to talk about some of their frustrations, how they could do it better. And you had all these mentors who could help you with some of the problems.
I would like every dentist to have the fun I'm having at it. The return on investment's a no-brainer. If you do 10 crowns a month, you pay for it. That's automatic, just in lab fees.
CEREC and my #1 assistant allowed my conscience to be affected. I really believe with all my heart that the CEREC machine made me a better dentist.
The CEREC and the Galileos together has really, people are so impressed when they see it, and then they see the white hair and then they really can't believe it. You know, it's something that an old geezer like me would get involved with the technology like I have.
When you see these people who at 50 years old, 55, 60, they're getting in knowing that they're doing this to sort of reinvigorate themselves, and they do, it is, to me, it's a great feeling knowing that that's probably the way I'm going to be. I just got to jump in on it way earlier than some of the people like Dr. Chuck or Leo.
For me, dentistry is my passion. And I'm here every day that I can, doing it. And I'm glad to do it. I'm afraid to give it up. I don't know what could possibly replace it. I have several hobbies, and they're all wonderful, but nothing equals dentistry. And I hope that this will be my passion forever. Amen.
Amen. That was great.
Awesome.